record this session. Okay. So I'm just introducing that Dr. Rokhsana Ahmed, who completed FCPS from Bangladesh, and also from the Nepal Center 2024 December completed MRCPCH. So we are here, everyone, to know actually the secret of success, you can say, or what was the pitfall and how was the exam, and what was the feedback they wrote by the examiner. So that would be greatly, I think, help others. So that I arranged it. Alhamdulillah, I also passed this exam on the same center, even not in the same center, in the same day we gave this exam, and in between the time of exam time, I mean. So we face to face, we smile to each other. That was a very nice experience. So, but remember that everyone's smiling, everyone's this hardship is there, but behind that there was a it is not shown that how much hardship was there. So everyone having different story, but you have to go through different difficult journey, and different experience could be. So I will add it whenever Dr. Rokhsana will help us that how it is, because you know that whenever you are in an examinee, then you passed out, but whenever you are something like you are helping others, you are doing mentorship, then it is a continuous journey. So you have to give this exam every time when your like colleagues are also giving exam. So that times also it is your exam. So I'm very much interested to know how it was. And also I see that some other mentors of MRCPCH clinicals also there. I hope they will also be benefited. So so we can start. First of all, Dr. Rokhsana, can you please tell me that first of all, when you completed your theory exam?
Assalamu alaikum. Yes, I have passed my theory exam on 2021.
That's nice.
Yes, in both AKP and FOP and TAS. Same year I have passed.
Okay, great. So after then, you appeared in a Nepal Center 2024. So can you please tell me within very short time that how it was your preparation time, and how much time you required? After then, we will go for the exam feedback.
Okay. So first of all, that I took a long time. First of all, the cause behind that, I was very much puzzled about the clinical exam. So how to take the history and clinical examination, because as I have passed my FCPS, MCPS in 2018, clinical is little bit easy for me at the part of clinical examination, but the history, communication, developmental station, yes, all that different from our Bangladesh exam. So I was looking for, and I was trying to study, but I don't get anyone honestly saying that anybody help me to guide me. And in Bangladesh time, a lots of mentors there, all are great, but in Bangladesh time, it was very difficult to match with other countries' time. So I took the under the mentorship, I took a lots of course and were waiting for study partner, and after day by day I came to know how to study it. And one thing here I want to mention that I feel is very important, that other people who are here, that when you are the partnership is very much important. Without partnership, I don't know how to pass the clinical, especially the clinical exam. Without any partnership, reading partner is not possible, I think. And But here, what I feel important that you have to suppose you are practicing yourself or your partner information giving scenario as communication. So it's better if you do this scenario in front of any mentor or who knows better than you, so that during this preparation time he or she will correct you. But if you are waiting that after taking all the preparation, I will took the mock and somebody will correct me, it will be too late. So I think for we will, it's not possible to do every scenario with mentor, but if you do some portion in for the mentor and other rest with your partner, this will be more beneficial.
That is
Yes,
your great advice. So you want to say that practice is very important here, with some expert on also, as well as with some colleagues. So what about
yes.
books? Is books also required?
Sorry, any
Any
books?
books? Yeah.
Yes, of course, of course. The main books is Mark Beatty, and now it is the Reham's note is very much beneficial, and I'm so much thankful to Dr. Reham. And Mark Beatty is some mentor told that A to Z from Mark Beatty. Believe me, I don't go through A to Z of Mark Beatty, but Mark Beatty is mandatory. It can take is the reference book because will help you, it will help you whenever
Okay.
anyone asks you from where you get this information, you just tell that I found this Mark Beatty. It's enough. So you
Okay.
have to go to Mark Beatty.
Okay, that's very good. Okay, can you please now start with your exam day? I mean, your circuit was started. How it your circuit started and what was your first session? Then you can describe. But in between time, if you want to say something special, you can.
Okay, okay, no problem. So my circuit start from I was the first person on the total candidate was 10, I think, and my first circuit was the clinical. It was the neurological examination, and the center was the Nepal center. And whenever just the instruction was the motor examination of the lower limb. And so starting from he was a very I think mashallah healthy child, and his gait is I yes, I found that he had some hemiplegic gait, but the child is well grown, you know, and the hemiplegic gait is not so much obvious, but probably the left hand is some flexed, and the he swing the left leg just little bit. Okay, then I'm doing the tone reflex, but believe me, the reflex is not exaggerated. I went for the clonas, but clonas was absent, and plantar, even I don't found that it was extension. And after then I told that I want to do the upper limb, and that time the bell was ring. So it was my first extension, and I'm so much worried as a first station. But that time the examiner asked me that what is your diagnosis. So from the first impression that he has some sorts of hemiplegic gait, and this arm is some flexed position. So I told her that it's the case of it's probably left sided hemiplegia, because I found this. So then she asked me that why you don't find any kind of extensor plantar, you don't find the jax is not exaggerated and muscle was not wasted. So how can you say? I told her that probably he was under proper physiotherapy for this reason. Then then she accept it. Then she asked me what may be the cause of this type of gait. So I told her according to antenatal, natal, and the postnatal, what is your management. Just I follow the management plan just like that. I will take the focus history, review his previous note, and as he is on physiotherapy, I will check his previous note, and for physiotherapy, medication, medical management, surgical management, and I will keep him under follow-up. And after that, the bell rang and my station was finished. And my remarks was in this station, just one remarks that she could not initiate the clonus. I tried to initiate, but I failed to, probably. That time they cut 1 mark from here. This
So
was my first station.
Dr. Rokhsana, clonus was not there.
Yeah.
You tried. Still 1 mark cut.
Yes. Still 1 mark cut.
Okay, so maybe clonus was there. I mean, maybe.
Yes, maybe.
It was not my case also, but clonus may be positives, but you could not evaluate. I mean, you
Yes,
could
yes.
not show
I
it.
could not initiate. Maybe due to a stress of the exam, maybe I couldn't initiate this.
Cut 1 mark.
So yes, they have written on my sheet that she couldn't initiate the clonus, and otherwise, Alhamdulillah, the station was all right.
Okay.
And then the second circuit was that they examined, and here I want to say one thing, that Dr. Morsheda told that in this circuit for clinical, Dr. Morsheda was opposite my side, and one of my another colleagues just crossing the another fourth station. So after whenever you return from your station, suppose I have finished my circuit 1, I'm waiting to get into the circuit 2. That time would have sit there, and you have get just 1 minute or some moment. That time with the I sign, we asked my fourth colleagues, that what is your case, and it was my biggest mistake, because because she told me that by sign language, child is short and squint is present. Because you can just interact, but it was my huge mistake, because I will tell you later on. And another station, because it is easy whenever you know from the other side before entering the room what was the at least the neurological examination or other. But I will tell later what was why I
want to say that we should not know the case. You can
you
can ask
yes,
for the station, but you should not.
yes.
Okay, that's
Yes.
great.
Yes, of course. Yes, whenever I come to the fourth circle, I will tell why it is you shouldn't know the case. Rather than you can know the what is the parabdomen or neurological, this is all right, but not never the case before. Okay, so I want for the second circuit, it is CVS examination, and the child was very much small for her age, but the child was so much cooperative and having respiratory distress. And then examination was done as per we have learned, and then the case was the VSD. So her differential diagnosis, how will you manage the case, and then what are the types of VSD, and how will you counsel parents, and when is the indication of the surgery, and do you feel it's a large VSD and a small VSD. And whenever manage, as we all know that how you whenever the in clinical exam, station exam, whenever examiner asks you how to manage, so I will take the focus history, review her previous note, and management is as she is in respiratory distress, so acute management. Acute management, I have told I will give the oxygen therapy, anti-failure management, and the long-term management. And then I will give the cardiac advice. Because whenever you told the examiner that I will give the cardiac advice, she will ask you what the advice you have given, what is the complication, and then my station was finished. And Alhamdulillah, it was good station.
So you got 8/8, right?
8/8, yes. And then the third station. The third station was parabdomen, and it was a case of thalassemia. And thalassemia parabdomen examination, there was a scar mark for splenectomy, and just as usual, hepatomegaly present, and there is patient was icteric, mild pale, and as there is a splenectomy mark is present, so it was very easy. So what is your diagnosis? What could be the differential diagnosis? And Yes, what should be the differential diagnosis, and how will you counsel the parents? What could be the complications, and what are the iron chelation therapy? And after that, the my station is over. And now the most complicated station, and
Yes.
what I'm telling that you shouldn't know, because yes, whenever
Abdomen
sorry,
station, abdomen station also 8/8, right?
yes, Alhamdulillah, 8/8.
Mhm.
Okay, and now my fourth station, most critical station,
Mhm.
because in this because in the sign language we are asking for another candidate, another senior colleagues was there. What was the case? And she told just sign language. She told short and ice and prison. So whenever I was waiting, it was a great mistake for anyone, because so I have matched there's shortest teacher and eye problem, maybe Turner's or Noonan, and that child was a boy.
Mhm.
But yes, so and before starting my station, the child want to go to toilet, and
Mhm.
whenever the child is come from the room, I found that the child is a boy, and so much playful that okay, this examiner told me that we will give you some time, you can just wait. Okay, and then the child returned and I have start my examination. But yes, so I found the child is small and my instruction was do the general examination.
Okay.
So I just look at him, and general examination. So I after observing her, I told her that I want to do the anthropometry. Then the examiner told that yes, on the table there is a growth chart you can follow, and I found that it is far below from the average. Okay, so it's a case of short stature. So first of all, I told the examiner that I want to do the maneuver. I told all the maneuver for the short stitcher and nothing is present. The child is not Russell Silva, not Turner, non Noonan, and not achondroplasia. No features of bowing of leg is present. Okay, then the examiner was in very much hurry that she repeated, told me just start your general examination. Okay, I started the examination, and I want to tell that from some mentor we came to know that hand, then examination of the eye, then um, other mentor told that examine the chest and heart and part abdomen, but the examiner told me no, just do the general examination. Okay, so I followed, and I don't then I remove my stethoscope from the heart, and then what else, because there's nothing. Then she asked me, so tell me what's your differential diagnosis. I told that it could be a case of short stature, and I want to do the anthropometry, and also want to parents height, mid parental height and plotting check. She told that mid parental height is normal and the child is far below. And then she asked me, tell me your findings, please. So I told that the child has squint and I want to do the examination for the squint, because I have no other clue. Because in my mind, because I know the previously short and eye problem, so there's nothing in my mind except that Noonan. Okay, but as I didn't find any features of Noonan, I didn't mention it. So I just told that there is a squint and I want to do the examination for the squint. Then she asked me what could be the examination for a squint. Then I told that cover uncover test, alternative cover test. Okay, then she asked me what could be the causes. So I told that there may be endocrine cause. She told me that yes. So tell me what endocrine cause can cause it. What history will be taken, and in the abdomen what you want to do. So Alhamdulillah, this is the great blessings of Allah. Then suddenly I told that it may be due to hypopituitarism. And that time she was started smiling. So she asked, I want to know me that any specific, I told the growth hormone deficiency, maybe this case. Then she asked me that what part abdomen examination you want to see. Then there is maybe single phallus. Then she told me that what could be the cause of hypopituitarism in this age. And I told the causes of hypopituitarism. So what could be the investigation if it's a case of growth hormone deficiency? Screening test is insulin-like growth factor 1 and confirmatory test I told, and then how will be the management. I told that I'll counsel. She told me no, just tell me the definitive answer. So growth hormone replacement therapy. What could be the complication and how will you counsel the mother? Just one line, and then my station was finished. And Alhamdulillah, this station I got 8/8.
So you mean that in this station, actually, it was a difficult station, and it was short but screen, and it was not correlatable. I mean,
Yes.
there was no diagnosis, but examiner was also kind, because if she become very strict, then we could not make diagnosis, because another thing is it is not very common that they gave you
Yes.
panhypopituitarism. And the child was weight was on 50th centile, right? Severe
Yes.
and 50th centile. So you can think over that it is short and obese, and what is the differential diagnosis of short and obese. And we learned from you, and also I want to say that my feedback also it is same, that if it is general examination, that not necessary to do all the systemic examination. For example,
Yeah.
abdomen palpation. So what is the general examination view? It will be there like this way. So so you want to say that if you in your own mood, without knowing the clue, then you can
Yeah.
perform.
Easily you reach, yes, but my in my mind it was running, and the exam stress was there, so short and eye problem. So what could be the, and my mind was running on the Nunan, but in the examiner in the hall I couldn't find any finds of Nunan. So it's better not to hear.
And another things what I learned from you, and also from my experience, then should not be preoccupied. You will go with your own clinical experience and you will perform. And this is the things. I mean, preoccupied is a very bad things. Like you comes to know that it is a VSD murmur, and if you enters into the station and you got it is not VSD, still you will heard the VSD murmur.
Yeah.
Preoccupied, so your hearing capacity will be changed. So not necessary to know the case. You are good enough, and examiner was really very kind, because they give good marks. Even if anyone can mistakes, small mistakes, they I mean, they not all the time, but it is very examiner to examiner very. Some examiner is strict, they cut marks, and some examiner is very kind. So it is like the exam is like this actually. Okay, proceed, Rokhsana.
Okay. Yes, and my fourth circuit is complete, and fifth circuit was the developmental station. So developmental station, my score was the full score. There's no comment, just one comment, excellent. And yes, so in the developmental station, just I follow the structure that I have learned from one mentor, and I am very grateful to him, because that it was not the as we all prepare the note, it is not like that. Just that after just 1.5 minute I come to know that what is the case.
How?
So how? Yes. So how? So just first introduce. You all know that how to take the history of the development. I'm Dr. Rokhsana, one of the candidate today. So I'm going to ask you about, suppose early cell condition. Is it the proper term? So will you tell me what is your main concern? Oh, I'm so sorry to hear about it. When you notice the onset, course, and duration, and then I did any event occur, and then what did you do for it? So whenever I asked her that what did you do for this condition, because it's a long, for last 2 years he is not able to, since birth he's not able to work, so what did you do? Is he's under any kind of team? Then she meant it, yes, he is under the physiotherapy. So can I know why physiotherapy? That time she told me she has some muscle problem. He has some waddling type of gait, duck type of gait. That time I come to know that what is the case. It could be male child and duck like gait. It could be because whenever I asked that it's does he under any kind of team, then she mentioned yes.
So you
Okay.
see, development station was this development station was difficult for some candidates actually, because role player is not saying everyone spontaneously. It is like you have to ask, otherwise going to tell you everything. So important things in development station, you have to run against time, right? Like you have to here within the short time, you have to ask the necessary questions, and as early as possible you have to reach the diagnosis, then it would be easy.
Yeah.
And it was very good, 12 over 12 really. I mean, it's very important to get a development good marks, otherwise it's difficult because it's 12.
Yes.
Very high here. Okay,
Yes.
so anything special with the development?
Uh,
Anything?
no, just I follow this structure that I have learned from one mentor, and then it was so smooth uh, conversation between the role player me, that I have complete in the due time. Probably I have, because in this exam stress there you will get sometimes, and before the times I have completed this, then the examiner told the role player came out from the room, and I was with the examiner, and my question was that present your case. And during the presentation, just I mentioned that what is the problem, what could be the behind the what is the cause behind it. I have made these formulas how to present the case. So I mentioned that what is the problem, what is the cause behind it, what is the associated problem, and other domain age.
Okay.
And then, yeah.
So actually, everyone having some format. I mean,
Yeah,
whenever
yeah.
examining, then you have a format. You have to strictly follow this. But main things is you have to practice, practice, practice. Too much practice is required, and I think development is most easily achievable because only 12 scenario or 15 scenario is there. So, but practicing way or format is same. You have to just follow the format and then you will get the station easily like this. Okay, so after then what was your next station?
Yes, in my developmental station. Okay, another thing, if anyone from Bangladesh, here there is one book that is Abid Hussain Molla, very much popular book in Bangladesh. Because when I have completed my post graduation degree, I have go through this book, and because most of the question, Alhamdulillah, I found what is the muscle biopsy found is in Duchenne muscular dystrophy. What is the difference between Duchenne and the Becker's, and what is the gene involved? Gene involvement is everybody know. And they another my request you to present that I because it's a genetic disease, and the examiner is waiting for the genetic advice for the family. It's very important. And other is, I think everyone has his own guideline. That's why, but whenever you get the clue what is the case, it will give you more confident.
Yes, yes. And
And
any genetic disease, genetic counseling must.
yes, and after this, my station was history taking. I get 1 marks cut from the clinical station, and history I get 2 marks less, and other station I get the full marks. So my score was 79. So in the history, my case was whenever you are the out of the station before entering the room, you get the note, and it was a diagnosed case of Crohn's disease, and take that history of probably 14 years old child. So whenever we get the 14 years, so I have to take the history of adolescent history format. I have to take. And then okay, some I want to share this information that every history taking station such as the development as well as this station, your language such as aha, oh, I'm so sorry to hear about it. It's a very difficult condition for you, isn't it? So making sympathy, empathy, eye contact, a nodding of the head, it is very much important because you will get the mark from this. Just two word, aha, oh, oh, okay, okay, yeah, yes, yes, I'm with you. Yes, yes. Will you please tell me more about it? Yeah, yeah. Just this line, but it will give a more good impression, and there is a marks for it. Okay. And now the history taking station, and Alhamdulillah, my history was good. But the problem that I faced that in my mark sheet there was two comment for this history station that that is clinical explanation, clinical reasoning explanation was lacking. So I got the point why she wrote this, because after taking history I complete the history during the time frame, and then she asked me what is your differential diagnosis. So why this cross child presents and another attack? So probably there is relapse, I told it. And then what could be the cause? That could be the cause. It could be ulcerative colitis, and other cause may be other diagnosis rather than inflammatory bowel disease. Probably she didn't hear my first, because sometimes you now notice that sometimes I tell something too speedy. Probably she missed my first differential diagnosis, but it was in her mind. She probably heard that ulcerative colitis may be infectious cause. So she asked me that what could be the infectious cause that causes bloody diarrhea. So I told that it could be Shigella can cause bloody diarrhea. Sometimes some Escherichia coli hemorrhagic variant may cause. Then she told, but in case this child, is it possible? Should you revise your differential diagnosis? So I was thinking about, I have told the relapse, ulcerative colitis, who could be other differential diagnosis. Um, that time, okay, how will you, what investigation you want to do? So I told, if it's a case of ulcerative colitis, so I told her, and what could be the findings. So I told, and then how will you manage that time? And after management there was a time, that time she again asked me, what could be your differential diagnosis if I gave you some times. So I told that it's the case, madam, relapse. It could be other cause, and ulcerative colitis may be that. That time she told that now you are telling that it's case of relapse. Yes, actually it's a case of relapse, case of ulcerative colitis. Okay. So what to do? This was my case, and she took 2 marks for it.
Dr. Rokhsana, it was a relapse case, but usually what happened in the case, something would be there, especially in the adolescent age. So, but the case was very clear cut. Child having,
Yeah.
so that was a dilemma. Sometimes we think that there could be, I mean, some factors, but I could not find
Yeah.
this. Yes, so
Yes, no, no cigarette smoking. The child was so cooperative, the role player. No
yes,
cigarette smoking, no taking any kind of alcohol.
stress even. Child is having no exam stress or any kinds of
Yes, yes, yes.
status was very clear. But
Yeah.
my case, I got here 10/10. So that time I said that it could be a relapse as a disease nature, but did not get any other causes. By I have to look for infection and other things. I mean, again, I have to ensure the child is not taking any smoking, and there is nothing. But the things is actually it's a very difficult every time to be calm and quiet and very clear cut.
Yeah.
And it is examiner also sometimes become
Yeah.
oriented. For example, my station, after when discussion started, after 3 minutes, he said that, when there is 3 minutes remaining, he said that you can now go. Bell rang. So I started to go out, and then he said, no, 3 minutes remaining, come. Again, the discussion started. So it was even wrote in the mark sheet that even I make examiner write that I made some mistakes. Still, the candidate was calm and quiet. So it was actually the examiner actually here are very much fair, because they even wrote it that he makes some mistake and it can be effects on the examinee. So I must appreciate these kinds of attitude. What
Yes,
do you think?
Nepal Center. Yes, of course, Nepal Center is very good, I think. All the examiner was cooperative.
And kind.
Yes,
Over,
of course, kind. Yes, yes.
yeah. Okay. So after history station, you have which
Fourth,
fourth?
my
Okay.
communication station, my communication circuit was started,
Mhm.
and my whenever before going to station there was a scenario, and the scenario was the small scenario, and it was a case of nephrotic syndrome relapse. Here I want to, and alhamdulillah, both station I got the full marks, and there is no remarks here in the communication station. So but you may hear from your senior that in communication it's better to draw something, but what I have to draw in case of nephrotic syndrome relapse, so I didn't make any drawing. Just I ensure the name, age, and he, because I have to address the child as he, and mom is Mrs. something.
Okay.
And then yes, and then as usual that introduction, after, and what I want to tell here that what is my agenda. The scenario was that it's a case of relapse, case of probably the third relapse of nephrotic syndrome, and the consultant is advised to start the prednisolone, but mom is not agreed because of starting the steroid. Talk to mom regarding this issue.
Mhm.
So just after grading, we all know that this is the proper time, and then uh, the thing I get that I will not ask how what is nephrotic syndrome. I will not tell her. So just here I asked her that how far I'm here to discuss the management plan, because some mentor told me that it's very important that addressing what is your agenda. So my agenda is that today I'm going to discuss about the management plan of Alice's health condition. Before starting this discussion, Mrs. Maria, I want to know how far you know about Alice's condition. Because why I ask it, I don't ask that I don't know about, I don't want to hear about anything she knows about the nephrotic syndrome, because third relapse probably any of the consultant or or doctor told her what is nephrotic syndrome, so no need to ask about this. Just then she told us, yes, I know about the nephrotic syndrome. He is has the relapse, and at this point I know, and I hear that you are going to start the prednisone, but I'm against it. Oh, I'm so sorry. The empathy sympathy sentence. So, will you please tell me why you are against this point? That she told some points that he gained the weight and his appetite increased last time. I was so much afraid. Thank you, Mrs. Maria, for sharing your audit why you are against this point. Thank you so much. But I want to reassure you, and just I put my point, and then she asked me, no, give me some another medication. There must be other medication rather than it. Please prescribe this medication. So the thing that when we weigh the benefit versus risks, here the benefit is more than the risks. And we will keep Ali in regular follow-up. We'll make his measurement of the blood pressure, weight. Is it okay? This is not so much why you are not prescribing other medication, because it is the most important medication, and whenever the course is completed his weight will come again the normal. Okay, are you following me the same line? Okay. And then she asked me, why won't you, because his father is not also happy. So could you make another meeting with him? Why not? Then I told them, and then the summarized leaflet, and then my station was finished, and I have 1 minute before more, because I told that probably I present too much in speed, that I every station I get 1 minute remaining.
But it would
Okay.
not, I mean, effects, right?
Yes, yes, no effects. Yes, Alhamdulillah, no effects. Yes,
Mhm.
no effects.
So I missed in between time 1 minute. So what was your main management for the third relapse of nephrotic syndrome? You said about steroid, right?
Yes, yes. She wants to tell that, please prescribe another medication, except because I came to know that there's other medication. Do you agree or not? Yes, I appreciate your knowledge, and I found that you are very much worried about Alice's condition. Yes, it's natural. I appreciate it. But the thing is that the prednisolone, this is the medication who is more effectively acts on this health condition, in this disease condition.
Okay, so that's the good things that you did not say any other medication is there. So
Yeah, 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 yeah.
medication. So if you say it, then they will cut marks actually.
Okay, okay, probably.
Knowledge is not important here. You
Yes,
have,
yes.
but if you want to give more knowledge, then you will be in trap. So
Yeah.
the basic knowledge in the communication station, most important things is you have to know the basic knowledge. You have to give empathy, sympathy. But what I understand that most important things is mom's concern or patient concern. You have to address this appropriately. You cannot
Yeah.
accept this. You cannot, I mean, you cannot say any other things what she wants to know. Other than you cannot say, I mean, you have many knowledge, but you cannot give this knowledge. You have to address mother concern that we have to
Yes.
follow.
Yes.
Okay, that's nice
Yes.
experience.
Yes.
Then
And then my this was my sixth circuit, and this was also communication, and the scenario was probably 10 line, probably. But you have less time. Okay, so in the page that I have, blank page, here I have written the name of the baby's name, I don't know, but mother's name. The scenario was like that, that 10 hours probably the postnatal age of this baby. The baby has hypoglycemia and convulsion. The baby had the seizure, and the blood sugar was low, and mom has difficulty in the expressing of the breast milk. And during the delivery, and the baby's birth weight was 2 1.9 probably, and postnat her the child gestational age is 42 weeks. 1 minute, 3 minute, 5 minutes Apgar score was normal. And now talk to mom, she was worried, just like this the scenario is that. So, and after just whenever I go through the all the scenario and setting everything in my mind, that time I have to enter the room because my time started. Okay. And then I started the scenario, that my I told about the agenda and how far you know about your baby cell condition. I forgot the name of the baby. Okay, then she was angry. She was angry that she my child got the seizure. What was the cause? And so I told that, yes, that empathy, sympathy, I'm so much. Then after telling the empathy, sympathy, I told that that time whenever we do the blood test, we found that his blood glucose level was low. So she asked me, so what would be the cause behind it? I told her that because in the first 2 to 3 lines there is that she has difficulty in the breastfeeding difficulty. So I told her that in the initial period there is some difficulty in the difficulty in the establishment of the breastfeeding, it may be the cause. That time she asked me, but I have other two child, they didn't have, so why this baby had this? So I after giving empathy sympathy, I told that another point may be that your child, this baby birth weight is uh, 1.9, the normal birth weight is 2.5. We call this condition in medical term that there is growth restriction. Here in this medical condition, there is a chance to become low blood glucose level. It may be a cause behind it. Then she asked me, so why you didn't keep my child in regular follow-up? Because there is a chance. You told that time empathy sympathy that yes, I can found that you are very much worried, but mom, I want to say that we kept your baby in our close observation at the 1 minute 5 minutes, and every time he was in this stable condition, but suddenly whenever he start the convulsion, we do the blood sugar level, and now he is stable. In the flowchart it was written that the child is now stable, and we are keeping your baby in regular monitoring. Then she asked me, so what could be on the later life? Then I give the empathy, and then told that the immediate, the after effect, we have to keep your baby in regular follow up. So then the regular question regarding the breastfeeding, that what should be I do for this in case pro of the breastfeeding. So I will make the meeting with breastfeeding team. They will show you, and then after the my bell is ringing, then for the warning bell, then I told the summary and other lifted other, and my station, the time was finished, and Alhamdulillah I got the full marks. There, there's no comment.
It's great. Okay, that's very nice. Okay, after then, I think you remaining things were the videos, right?
Yes, yes.
Two videos. Okay. Um, so it was also
Yes,
six, six,
six,
both.
six. Yes, yes, yes.
Yeah. Okay, then what was the first video?
My first video was mastoiditis.
Hmm.
So yes, mastoiditis. One of my colleague told that 4 points is needed to. You have to mention 4 points in mastoiditis.
Hmm.
Now I forgot, but there is obliteration of the obliteration behind one of the line behind the pinna, and
Yes.
there is yes, the auricle is protruding, and at that point we know there is a reddish swelling.
Hmm.
And actually he was waiting for 4 point, and then what is your differential diagnosis, what history, examination, investigation. Then he asked me, because I told all things very speedy, so he asked me, so indication when we involve the neurosurgeon, and what are the indication, and what are the indication, and what antibiotic we will choose, and when we will switch the antibiotic, and then the time is over.
So in this video station, if you, I mean, if you missed any important things, they will cut marks actually. Like
Yes.
if anyone missed, the pinna will be goes
Hmm.
forward. So if you missed this point, if you missed the angle is obliterated behind the pinna, they will cut 1 marks because it is a very common video, repeating video. Every time, actually, I see that every year at least 3 to 4 center it came. So we have to be prepared very well for this acute mastocytitis video, and you have to say the acute mastocytitis. Okay, then the next scenario.
Yes, the last scenario video station, and the station in this video I never found. There is a swelling of the neck. Okay, and the child is a young child, adolescent child. But there in the left hand, the when who is doing the video, she is showing that in the left hand he is wants to find something. In the hand, he is
Yeah.
wants to find something. Yes.
But it was
So
obvious that it was a BCG marks. but it was not obvious in the video.
Yeah.
It
Yes.
was not, it
Yes.
was video. You know that,
Hmm.
but they, okay, so continue. They want to know.
Yes. Yes, she then the examiner asked me, so I told I present the case. Then she asked me what is the differential diagnosis. So I told it could be a case of cervical lymphadenopathy and this leukemia, lymphoma. This would be the cause. Then she asked me why the examiner is looking on his hand, yeah, on the axilla. I told that probably axillary lymphadenopathy. She told not specifically left arm, upper arm. That time probably due to exam stress, I was so much stressed. Then she asked me that what history you want to ask, and then what examination. And during the examination, I don't know why I told the BCG scar mark. I have to say that time she came to the previous point. Yes, so look at the look at the video. Why what she is looking in the arm. That time I got the point. Yes, it was BCG scar mark. So third differential diagnosis was tuberculosis. It could be because in UK exam there is less chance of tuberculosis. Okay, but she asked, and then I told this yes, it could be a case of tuberculosis. Then she asked the question from the lymphoma. So, what could be the investigation for the lymphoma? And she wants to know about that. We want to do the CT scan of the chest. She want to see. She want to hear that in the CT scan of the chest, what findings you want to know if it's a case of lymphoma. That time I told that there would be mediastinal widening, and then what could be the treatment, and then my station was finished. How do you manage the case? And then I told, and my station was the finished, and I got the full marks.
Roxana, here actually, the child was well grown, not looks like or
Yes.
something, but saying first lymphoma was not easy because uh, it could be, I mean, when the diagnosis is and how much time went through. So here I say tubercular lymphadenitis first, and then I said lymphoma. But
Okay.
not the marks. Examiner said if lymphoma is your first differentials, then what is your investigation or something. So if the case is not obvious, so we can make our diagnosis anything like BCG marks was searching, but BCG marks
Hmm.
or present, it was not very obvious. And
Yes.
mark not, if BCG mark even present, it doesn't mean that tuberculosis will not be there.
Uh,
But examiner was, I mean, not cut marks for that reason. And also there was another, here also video station, I got 6/6 in both. But here examiner asked me another questions that what is your team? And that times I said that pediatrician and everything, but I didn't say about the surgeon. And then she said anything more, and then I could not say actually that the surgeon, I not think over the surgeon actually. Then examiner said that so if who will do the biopsy, then I
Babsi. Yes, yes.
understand that yes, I have to say the pediatric surgeon. So it is also one of the learning that we have to say the pediatric surgeon or the surgeon for any kinds of biopsy if needed, then we have to involve it in our team. So it was a nice experience, but Dr. Rokhsana, again, congratulate you. And as I comes to know about you, and we meet just before exam, but I understand that you work very hard. So it is not very easily achievable things for all. I mean, you worked very hard, and you got the result like and of course it is Allah's blessings as well. So here listeners do have any query you want to ask? So if it is not there, then we can here end our meeting, but we are hopeful that it's really become beneficial for you. And it is our aim also to arrange here so that those who are here can be benefited from our experience. Thank you, Rokhsana.
Thank you, Dr. Mosheda, and again, congratulations you.
Thank you. So we
Yeah,
will meet, inshallah, to if we can benefit others. Thank you.
inshallah.
Okay. Allah Hafiz. Bye. Good night.
Assalamu alaikum.
Thank
Assalamu
you.
alaikum.